Hi, my name is Natalia from UNES Public Health Undergraduate. In this video, I would like to explain about plaque. It is one of the examples of arthropod zoonosis. So let's get started. Plaque is an infectious disease that affects rodents, certain other animals, and humans. It is caused by the Yersinia pestis bacteria. How do people become infected with plaque? People most commonly acquire plaque when they are bitten by a flea that is infected with the plaque bacteria. People can also become infected from direct contact with infected tissues or fluids while handling an animal that is sick with or that has died from plaque. People can become infected from inhaling respiratory droplets after close contact with cats and humans with pneumonic plaque. There are three different forms of plaque. The first one is bubonic plaque, septicemic plaque, and pneumonic plaque. For the bubonic plaque, the patients develop sudden onset of fever, headache, chills, and weakness, and one or more swollen, tender, and painful lymph nodes, which is called buboes. This form is usually the result of an infected flea bite. The bacteria multiply in the lymph node closest to where the bacteria entered the human body. If the patient is not treated with appropriate antibiotics, the bacteria can spread to other parts of the body. For the septicemic plaque, the patients develop fever, chills, extreme weakness, abdominal pain, shock, and possibly bleeding into the skin and other organs. Skin and other tissues may turn black and die, especially on fingers, toes, and the nose. Septicemic plaque can occur as the first symptoms of plaque or may develop from untreated bubonic plaque. This form results from bites of infected fleas or from handling infected animals. In pneumonic plaque, the patients develop fever, headache, weakness, and a rapidly developing pneumonia with shortness of breath, chest pain, cough, and sometimes bloody or watery mucus. Pneumonic plaque may develop from inhaling infectious droplets or from untreated bubonic or septicemic plaque that spreads to the lungs. The pneumonia may cause respiratory failure and shock. Pneumonic plaque is the most serious form of this disease and is the only form of plaque that can be transmitted from person to person through droplets. The basic transmission cycle of plaque is that fleas become infected by feeding on rodents such as chipmunks, prairie dogs, ground squirrels, mice, and other mammals that are infected with the bacterium Yersinia pestis. Fleas transmit the plaque bacteria to humans and other mammals during a subsequent feeding. The plaque bacteria survive briefly for a few days in the blood of rodents and for longer periods in the fleas. If you ask, could one person get plaque from another person? The answer is yes. Because when a person has plaque pneumonia, they may cough droplets containing the plaque bacteria into the air. If these bacteria containing droplets are breathed in by another person, they can cause pneumonic plaque. Human-to-human transmission is rare and typically requires direct and close contact with the person with pneumonic plaque. And for the incubation period for plaque, if someone exposed to Yersinia pestis through the air would become ill within 1 until 3 days. When bubonic plaque is left untreated, the plaque bacteria can invade the bloodstream. And when the plaque bacteria multiply in the bloodstream, they spread rapidly throughout the body and cause a severe and often fatal condition called septicemic plaque. Untreated bubonic plaque can also progress into an infection of the lungs, causing pneumonic plaque. If plaque patients are not given specific antibiotic therapy, all forms of plaque can progress rapidly to death. To diagnose plaque, if the health worker suspects plaque, The sample of patient's blood, sputum, or lymph node aspirate are sent to a laboratory for testing. Once the laboratory receives the sample, preliminary result can be ready in less than 2 hours. Laboratory confirmation will take longer, usually 24 to 48 hours. Often, presumptive treatment with antibiotics will start as soon as samples are taken if plaque is suspected. To treat plaque, it can be successfully treated with antibiotics. Once a patient is diagnosed with suspected plaque, they should be hospitalized, and in the case of pneumonic plaque, they should medically isolated. Antibiotic treatment should begin as soon as possible after laboratory specimens are taken. To prevent a high risk of death in patients with pneumonic plaque, antibiotics should be given as soon as possible, preferably within 24 hours of the first symptoms. So that's all my presentation. I hope you all find it useful and helpful. Thank you.